we're doing this podcast series and it's Heroes for Oral Health. And basically it's the different types of heroes that interact with us. So grant recipients, scholarship recipients, our donors, board members, the different people that we interact with that are really, making a difference and working hard to change the landscape of oral health. Thank you for joining us today. You wouldn't mind just briefly introducing yourself and who you are, your role in the organization, and how you heard about your first contact, I guess, with the DTA Foundation.
Sure. So my name's Kate Flanagan. I'm the Philadelphia Regional Manager for Kid Smiles. And so as the regional manager, I oversee our clinical operations as well as our call center and have some oversight of some of our programs as well. And with DTAF, we know, the generosity of the foundation in the past, and Kid Smiles has been lucky enough to receive grants through them. The most recent one being to fund one of our recent programs that I had oversight of. So it's a great opportunity to be able to connect with you guys on this.
Yeah, so can you give a little bit of background into Kid Smiles and kind of what you all are doing?
Sure. So Kid Smiles was founded in 2001 as a nonprofit dental organization for kids in the city who are uninsured or underinsured. And the whole concept behind it was to give the private practice experience to the public sector. So it's really supposed to be able to serve pockets of need. And our mission is really to find that need, whether it is financial or otherwise, and find a way to help them gain access to care. So our programs, the one that we'll specifically talk about today, is our inclusive dental program. And that area of need is to get kids with special needs or any sort of disabilities, oral health care that they deserve at kind of meeting them where they're at. So they might not have a typical experience, but our practice is able to tailor the experience towards that child. So they're getting the experience that any potentially neurotypical or any other child would get.
Can you briefly explain the kind of barriers that children with developmental and physical disabilities face when seeking access to oral health care?
Sure. So the first one that is going to come to mind, especially for most people, is going to be finding a provider, because many providers aren't equipped with the knowledge to treat children with additional needs. So not only do dentists need training in the area, but the auxiliary staff need additional training as well. And it's not even just training to be able to provide the care, it's training to be able to provide a good experience and a successful one for the families. Another barrier is going to be insurance for any child with an additional need. So any sort of developmental or physical disability could require greater time commitment from a dental team. And dentists are reimbursed at the same rate for any visit. So just because somebody has some sort of disability, if they get a pro fee, they're going to be reimbursed at the same rate as anyone else who comes in from the healthy population for a pro fee. So that really deters providers from providing this care also. I guess the final barrier that comes to mind is that oral health care is probably a lower priority for these families. If their child has a disability, they're probably attending many appointments, and hassle of finding a provider specifically for their child might be an additional burden. So what Kid Smiles does is we try and really promote the program in places out in the communities, so these families don't necessarily have to seek us out. They don't feel burdened with finding that provider. They've heard of us from somebody they trust and are able to just reach out. So try and break down some of those barriers.
Can you go into why it is so important for children with special healthcare needs to still have proper access to quality oral health care, and why that is important for them and their families?
Yeah, just like the same message we preach to a general population, that your oral health is directly connected to your overall health. And a kid with special healthcare needs, they might have a compromised immune system due to whether it's a medical treatment they receive or a disease or anything that they may have. And bacteria from the mouth can cause infections in other parts of the body, especially in a kid who has a weakened immunity. Another reason it would be important would be that the child needs a healthy mouth in order to eat foods to give them the proper nutrition. A kid might not be able to express that they're having the pain, especially somebody who may have, you might have a nonverbal kid who can't express what's going on, and you don't want that to impact what they're able to, the nutrition you're able to supply the kid with. with. Another thing, a child with special healthcare needs might not let a parent sit and brush their teeth. They may have an oral aversion or something else going on. So a thorough cleaning by a hygienist is really important. Also, children with disabilities take lots of medications. The medications can negatively impact their oral health as well. It can create things like excess saliva or dry mouth and conditions that are just going to negatively impact the teeth and gums. So the regular dental care and preventative treatment we can provide could help reduce, the complications that come from those medications.
How will this project specifically better the access and quality of oral health care for the children that you guys are specifically trying to help?
So one main way that we're going to provide better access is just by being a location that the families can easily attain appointments at. Like I said earlier, they don't have to research and find somewhere. We're there and we're ready to provide the appointment. Also, support from the Dental Trade Alliance Foundation has allowed us to get our staff trained and make physical accommodations for our offices. So we're able to advertise the program in many places so parents aren't seeking us out. We're also specially trained to treat the patients, and we're able to treat a large variety of patients without referring for sedation because of that training. Our team also spends time with the patients to get to know them so they understand what's going to work and not work at their next visit. That allows us to make the visit something that families may not dread and reduce dental anxiety, which for a population that may not go to a dentist or have as much experience with the dentist is a big deal for us. That dental anxiety piece is really important in breaking that down. But all those things combined allow us to provide the exceptional care to these families and really has already made this project success off the bat.
So what is your team most excited about for this project?
Definitely, I would say helping families. Over the years, Kid Smiles has expanded services and broadened programs. Inclusive Dental Program addresses a significant unmet need in the dental community as a whole. The program opens the door to a care model that's compelling and enriches our mission and our team. We already have many families who schedule their next appointment before they're walking out the door, and making a relationship with them has been really exciting. We know the family's names, we're understanding the needs of the child, and we're seeing improvement with each visit. The families also grow in oral health care routines at home and are able to prioritize dental visits. Being able to see those small positive impacts already makes me feel encouraged that we can have an impact on many families that we have the opportunity to serve throughout this project.
That all sounds great, and we're really excited to see where, the kind of impact this project can have. Thank you again for taking the time and talking to me about this exciting project.
Absolutely. Thanks for inviting us.